I'm Monica White. I'm an acute care nurse practitioner, and I work with Texas Oncology in East Texas, Longview, Texas. And I'm at JADPRO 2025. The other thing that we did different this year, which I hope will be very helpful, is we talked about adverse events. So these are the things that none of us ever want to happen, but procedures are procedures. And so there are things that happen, like, and if you query the literature, you'll see some of these things, but fracture. I've never had that happen personally, but it's certainly on the differential for what could happen in a frail individual, especially somebody who might have osteoporosis. And somebody who might have myeloma or plasmacytoma, and certainly we have risks there. We talked about bleeding, and that is a risk. It's not common, but certainly a risk. Having a low threshold for bringing a patient back if they do call and say, yes, I've got a hematoma. So we want to lay eyes on people and know what that looks like, how big it is, and then that will resolve over time like they do in other areas of the body. We also talked about the possibility of retroperitoneal bleed. I have not had that in my practice, but I do see it in the literature, and so that can happen as well. And that is also something that we need to be aware of. And so we have actually a pelvis, just a bone structure that we use as we teach, so that as we're showing someone how to find the posterior iliac crest, we can use that model and actually show it on the skeleton itself, which is helpful because we need to know what is behind the bone in the area that we're actually inserting the needle, so that we're mindful of that. I think learners or APPs that are learning this up, for the first time, they just want to get the sample, and so just knowing that there has to be some reservation and calmness and slowness to the procedure, and when to know that you just need to abandon ship. So we walk through all of that as well. So I find that that APPs have embraced bone marrow biopsy, and then Kevin did the Omaya and the lumbar puncture, and really found it helpful to do this as a group. This year we actually had some people that had actually done 10 or 15 of these, and so they actually had a little bit under their belt. And then we had half the group that had never done it before. So even as we were teaching, there was teaching going on by each of those models, between people who had a little bit of experience and then no experience at all. So that really worked out very nicely as well. I think it's also important to, before an APP would come and be part of our class, is to have a mentor at home. So I had one physician that was very proficient in bone marrow biopsy 20 years ago when he taught me how to do this. And we kind of worked out our rhythm about the process. And what he and I did is that we walked through the process. I made notes about, kind of the order of which I was going to do things. And then I did the first few things. So I prepared the patient. I talked them through. I looked at allergies. I looked at medicines. I got them placed prone, prepared the sterile field, numbed the skin, numbed the periosteum, and then he took over. So the next time I did all of that, and then I numbed the periosteum. I actually went down with the needle, the Jamshidi, and got to the area where I thought I'd get a core, and he took over. And so we just did that for about 4 or 5 bone marrow biopsies, and until I had done the whole thing. And then he stood, in the room for backup, but did not, do any of the procedure. And then pretty soon he stood outside the door. And so that was just the way that it worked for me. Now I found that some of those steps aren't even necessary when you have the simulator, because you're actually working those things through on the simulator before you're with a person. But finding a mentor, whether that be another APP or a physician who is actually going to be the one to mentor you when you're back at home until you're proficient, is really important. Because if you don't have that person, then your time is not well spent when you're here at the conference to learn how to do that. So, and we do that in my practice in Texas Oncology. We actually have a program very similar where we are teaching each other, and That's really been a game changer for proficiency and for the clinician to feel confident in what they're doing.